Hello, beautiful Facebook community, and welcome to today's training where I'm going to talk a lot about how to exercise post-hysterectomy or other major abdominal surgery. These are gallbladder surgeries, endometriosis surgeries, and other kind of major procedures that affect a woman's kind of core and abdominal area. So what are we going to cover in today's training? So first of all, we're going to talk a little bit about the statistics. Now, I have, with a bit of a horror, discovered that there is actually about 600,000 women just in the USA alone who get hysterectomy each year. Now, there is a phenomenal number, and what most of these women complain about is the lack of direction to recover their strength and fitness, to return safely to exercise without the risk of further injury or things like prolapse. So 600,000 women just in one country, it's huge. So all over the world, there is literally millions of women who have gone through this procedure and have no or very little guidance in how to return to full strength and how to return to exercise in a safe way. So we're going to cover that. Then we will talk a little bit about what exercises are safe in the initial 12 weeks post-surgery. We are going to also talk about how to prepare your body for this surgery, because you don't just have to walk into it completely oblivious with no prep. You can actually do quite a lot of things that will then affect your outcomes and the speed of your recovery. We're also going to talk about what kind of exercises to do after the 3-month mark, and how to kind of take exercise and how to possibly transition into slightly different exercises. We're going to talk a little bit about the risks of exercising in the first year post-surgery, because it does actually take almost a year to gain a full recovery. So it is a bit of a slow, lengthy process that requires a lot of patience and a lot of care and a lot of listening to your body. And that really is the message that I would like to tell you about this whole life. It's to have patience, to really listen to your body. Your body has gone or is just about to go through something very, very major, and that will take a bit of time to recover from. So if you have any questions, just pop them in the chat box. I will answer them. If you're watching on the replay, let me know that you are watching it, and let me know who you are and where you're tuning in from. It will be really good to know. And if you are comfortable sharing, tell me your experience too, because I love hearing women's stories and their experiences in, hysterectomies and other abdominal surgeries, and how it's affecting their way that they can exercise. So statistics I've already talked about. It's an incredibly high number. I have coached many, many women with post-hysterectomy and helping them return to full strength and fitness. So I understand that it's a massive challenge, and sadly, there is very little guidance from doctors. Often they err on the side of don't exercise at all, or don't return to your former exercises at all, because they just don't want probably the risk. But I can assure you that with the right exercise, you must absolutely will return to your previous levels of fitness and strength, and to the sport that you used to enjoy before your hysterectomy, whether that's surfing, running, biking, or any other sport. So what to do directly after surgery. The main recommendation in the research and the studies that I have read, and also from experience, is that you absolutely must move. So moving your body in a gentle way will aid your recovery. It will support your lymphatic system, so your drainage, so you'll be healing quicker. It will also kind of get all the drugs and medication out of your system quicker, and it will make you feel good. So you absolutely must start moving as soon as you possibly can. But obviously, don't go for a run. I would suggest that in the initial weeks, the first 4 weeks post-surgery, you want to do some very gentle mobility, specifically for the upper back. So a lot of women, and I have gone through endometriosis surgery, so I could very clearly remember what I felt like in the initial first few weeks. You're going to have a lot of pain in your shoulders and in your upper back. So they pump you full of gas just to kind of open everything up in the abdominal area so they can have a bit of a look around. That gas, for some reason, gives you incredibly sore shoulders and sometimes hips as well. So in the initial first few weeks, I recommend that you do some gentle mobility for the upper back, for the upper body, so the shoulders, the thoracic spine, the shoulder blades, and then a little bit of hip mobility as well. Chances are that you're going to be doing lots of lying around and a lot of resting too, so you're going to probably feel quite stiff. And these are some of the main complaints women tell me post-surgery in the first 12 weeks. They feel very stiff and very tight and quite achy in the joints. So gentle mobility. I'll be posting some videos of mobility that you can do in your bed if you don't feel comfortable getting out of bed just yet for longer periods of time, okay? But definitely mobility for the upper body and for hips as well. And post those 12 weeks, you need to start introducing some very gentle core exercises as well. Not sit-ups, not crunches, but some very gentle core exercises and breathing and just kind of squeezing the area to start healing. Let's delve a little bit into preparation. So you've got your surgery scheduled, and usually there is a little bit of waiting time unless it's obviously an acute surgery. So what can you do? So without a doubt, the fitter and the stronger you are going into surgery, the faster your recovery will be, and the quicker you will return to your pre-surgery fitness and strength levels. So if you are not currently exercising and you know you've got this big thing ahead of you in the future, then I strongly urge you that you start exercising, start walking, and start doing some mobility. That will definitely be extremely helpful, and some gentle core exercises as well. Prep your body for this. It's going to be big. You know it's going to be big. You're going to be in pain. It's going to be uncomfortable. And going into it with muscles that are not strong and can't support your core very well is not a good idea. 6 weeks is enough for you to actually get to a decent amount of strength and fitness. If you need some help with that, please just reach out. I've got tons of free resources, or I have some shorter programs that will help you get fit, and you can just do it 10-15 minutes every day from the comfort of your own home. You don't have to join gym. You don't have to start weightlifting either. Okay, it can be actually quite simple. Mobility and gentle core work. And so what will happen going forward post those 3 months? So a lot of women are quite scared to exercise even post those 3 months after they get the all clear from their surgeons or their doctors. And understandably so. Okay, women are often scared of prolapse or further injury, and things usually don't quite feel the same. Women tell me that they feel quite disconnected from their bodies. They feel like they have lost their strength. They don't really trust their bodies, so they don't really have confidence in their bodies, in their physical abilities anymore. And those are very valid fears. So what I would recommend that you find exercise that is a little bit more low impact and low intensity, just to allow for you to gain confidence again in your physical abilities, to suss out where your strength levels are, where your fitness levels are, to think that you will be able to return to your pre-surgery activity levels. It's simply not true. You need to give it a little bit more time. And this is where I found, again, mobility and mobility flows really beneficial because flows and mobility allows you to reconnect with your body, to really suss out in detail how you feel, how you move, what is causing you pain or discomfort, where you've lost conditioning, where do you need to put a little bit more work in. So I suggest to women that apart from walking, which is so good, start with mobility and mobility flows. These are gentle and they will just slowly take you to that kind of next level of where you can start regaining your core strength, your confidence in your body, and reconnect with your body. A lot of women tell me that after surgery like that, they feel very disconnected from their bodies and they don't feel whole. So there's a lot of emotions, there's a lot of grief, there is a lot of loss, there is probably a lot of dealing with pain, and these emotions should not be belittled or disregarded as very valid. They are very valid, and you know that a lot of negative emotions that you don't process will get somehow stuck in the body and will create pain as well. So mobility and mobility flows, gentle movement. You need to be a little bit careful about prolapse as well. So these are probably the things that women fear the most, is the fear of prolapse, and rightly so, because when they take your uterus out, so if you have full hysterectomy, even ovaries, there's going to be some spaces created in your abdomen and your organs will be shifting around, filling that space. So things would feel different because they are different, and you will feel that. So the fear of prolapse is very real, and you need to be careful of that. So doing exercises, perhaps not squats, no jumping, no obviously plyometrics, those kind of movements that are very jarring and that create a lot of downward pressure. I would not recommend in the first 6 months to 12 months. There is plenty of movements you can do that will give you the same results without the risk of the downward pressure and obviously jumping as well. So I would suggest that you start again with mobility flows, and maybe transition. I love the steel mace. I have coached many women back to full strength and full core strength and full fitness and health using the steel mace because it's low impact, it's very potent, it's got mobility baked into it as well, and it allows you really to tune in, and you can just do some really super gentle flows. You can just do weighted mobility with the steel mace. So I am a big fan of steel mace training, gentle steel mace training, to take you from that disconnect and maybe some gaps in core conditioning into gaining your core strength and your overall strength and fitness back. And so as I said, it probably will take a full year for you to be back to health. Some women are lucky and they bounce back really quickly. For some women, I talk to women who even years and years post-surgery still don't feel the same. They're still scared to exercise. They are worried about prolapse. They feel very disconnected. They have a lot of pain. And that's probably what I didn't talk about, is that post-surgery, a lot of women will be experiencing pain in the lower back, pain in the hips, pain in other areas of the body. So not necessarily where, if you had incision, not necessarily in those places, but there will be some pain in the body, usually the lower back and usually the hips. And these can be really successfully and very quickly resolved, again, with mobility, gentle movement, even if you have some stuck emotions in there. I know that a lot of women that I have worked with mobility through those emotions and got completely rid of their pain. Okay, you should not be living and moving with pain. It is not normal, and it's not something that you should be getting used to. There's definitely help, and as much as the medical world is really helpful in giving you medication and things like that, it is essentially movement that will take you back to full health. And again, I cannot stress enough how potent gentle mobility and mobility flows are in those recovery times where you just need to take it slowly and gently and just basically starting from scratch and rebuilding your body back again. If you want some assistance, I have tons and tons of free resources where you can start with mobility and mobility flows entirely for free. If you want to do the full prep, I have a full 3 months mobility and strengthening bodyweight program, or obviously I have the steel mace program as well. So whether you are waiting for surgery and you would like to do some conditioning, let me tell you that even 6 weeks is enough to get to a certain level of strength that will help you. If you are post-surgery, then I have a mobility challenge with very simple, easy exercises. And then if you want to take it further, I have many other programs, smaller and bigger ones as well. So know that you can take the power back. You don't have to just wait for your surgery and do nothing. You can be really proactive and do a lot of things that will truly help you with the recovery afterwards. And if you are still struggling, even months or even years post surgery, then know that just invest in yourself. Just start doing some exercises that are gentle and they will support you. And I have so much experience in coaching women post surgery, and I have been through it myself as well. It was a long time ago, but I very clearly remember the whole emotions, post surgery, how I didn't feel like my body was my own. I felt really violated and kind of invaded because there were people kind of inside my body cutting and singeing things off. So I really feel for you. I really understand the whole, a few months post surgery, how you don't know how your body works anymore. You don't know if you have access to the strength that you did have anymore. Your pelvic floor feels all kind of weird. And if you're having the surgery in midlife and you are in perimenopause and menopause, that is another whole added kind of, I wouldn't say complication, but that's another whole thing to be considering, that you have less hormones in your body, you are aging slightly, you might not have so much strength to start with. So if you are in midlife, that's probably even more challenging. So if you need any assistance, please do reach out. I have so many options ranging from completely free to obviously full comprehensive coaching program where you can also work with me one-on-one if you want to nurse yourself back to health and you want more individualized support from me, then please do reach out. It is not necessary for you to suffer. It is not necessary for you to not be living your life to the fullest post surgery. There was just a hiccup in your life and you have so much more time to look forward to, where you want to be having amazing experiences and adventures and live your life to the fullest. So I hope you found this live helpful. If you have any questions, just put them in the chat box. If you want to chat privately, please send me a message, because I understand that this is quite vulnerable and you might not want to be putting your comments on a public page. So please do send me a message. Even if you just want to tell me your story, send me a message on Messenger so we can talk in privacy. And I am looking forward to doing some more content on exercises post-hysterectomy. I'm sending you lots of love, wishing you speedy recovery if you've just had surgery, and if you are waiting for one, then know that you can absolutely gain your full strength and fitness and health back afterwards. So I'm sending you lots of love. Ka kite ano, and I will see you soon for more lives.